If I start with what do we have good evidence for, we have really good evidence that exercise therapy can be helpful, and that's hip and knee exercise particularly. And so I think not just giving a recipe approach, but actually tailoring the program based on your assessment, you're probably going to get better outcomes. We don't have good trials to support that, but that certainly makes logical sense. But regardless, if you have a good exercise program, that can be beneficial. I would expand and always look at the foot and ankle as well. And I'd also look at the trunk and the core. And often my programs would entail that. So not just the hip and knee, which is where the evidence kind of lies. We'll come to patient education in a second. So education on load management and a whole range of other things. In short, we don't have good randomized controlled trials to say that education is of value. We do have some trials when you pull them together which compare patient education to exercise therapy, that there may not be a lot of difference in outcomes. So you may be able to get similar outcomes from a good quality education provided by you as you might get with exercise. You probably get better outcomes with both. If we look at adjuncts you might provide alongside your exercise therapy, taping is certainly effective in the short term, and there's a couple of RCTs that show that. In the longer term, doesn't really make any difference. So it depends which systematic review you read as to whether you think taping helps, because if they look at longer term outcomes, they'll say that taping doesn't help. If you look at the more immediate short term over the first few weeks and you tailor your taping, so by tailor I mean you're not just whacking a piece of tape on and hoping for the best, you're actually trialing a few things. So you're trialing some glide of your patella, you're trying some rotation of your patella, you might do some fat pad offloading. When you actually tailor it, it can be very beneficial in the short term, and the evidence supports that. But long term, it's not going to fix the problem. So use that as an adjunct to help get people engaged with exercise, get them through their run, get them through whatever exercise they're doing.